Today, we are joined by Dr. Dela Taghipour, who is a Montgomery County resident doing amazing things in the midst of this coronavirus. She spent some time up in New York City. Now she's back here in Maryland at Johns Hopkins University. Thank you so much for being with us today. It's a pleasure to meet you.
Oh, it's a pleasure to meet you too, Susan. Thank you so much for having me on.
Tell us a little bit about the coronavirus. I know you've been really embedded in this for the past several weeks, and how it's been presenting itself over the past several weeks. What have we learned?
Yeah, we've learned a lot over time. We have to remember that as far as viruses go, even though we feel like we know so much about this virus, we only have a couple of months of information. Over those few months, we've learned that the symptoms go beyond what we might think a normal virus might have. So, beyond your typical cough or sneeze or fever. Now, those are, of course, part of the symptomology, but the other symptoms that have been occurring are loss of taste, loss of smell, and those sort of came about and were particular for people. And then you can also have some less common symptoms like gastrointestinal symptoms like nausea, vomiting, diarrhea. So that's been part of our learning process. And then, of course, learning what medications we can and cannot use, what things have been beneficial, learning all about what family of viruses this is from and how it came about. So we're just every single day, I feel like we're learning more and more.
Yeah, it sounds a lot like the flu, but it's a very, very different type of virus than the flu. It's much more serious.
That's right. And the family of viruses that COVID-19 is a part of is, of course, the coronavirus family. And those viruses don't necessarily on their own make this more serious, but what this virus is doing is much more deadly than our typical flu.
Yeah. Why are some people more prone to being hospitalized with this? I know a lot of folks can have it and it's very mild and they're at home and it's really not a problem. And then others, really end up in a severe situation when they contact this disease.
Yeah, it's a really heartbreaking situation to watch and be a part of. So what we know so far is that um, everyone can actually get coronavirus. That's part of something we've learned over time. We used to think that sort of little younger children, infants, and then young healthy people were sort of safe from getting the virus. And we've learned that actually it's just as likely for you to get it at any age. Now, what changes is how likely you are to get really sick from it. And we know from early evidence up until now that folks who are 65 and older are getting it at higher rates as far as the more severe end of the disease. And people with different comorbidities, if you are immunocompromised, if your basic immune system has a lower threshold for getting sick because of an illness you have or because of a congenital illness that you have, that you are going to be more prone to the more severe version. And then there's a whole bunch of other comorbidities like diabetes and chronic lung conditions, smokers, folks who are just showing more signs of the more severe disease.
Now, I know you're recently back after having spent time in New York City, several weeks, if I'm correct. Talk about the shortcomings that you faced there. They had a very severe outbreak there. And what can we learn here in Maryland from that?
Yeah, I spent 2 months in New York and I was there from March 1st when they had their very first case. And I was there to watch sort of that really painful climb to becoming the country and the world's epicenter. And, everything changed week by week. And I think the shortcoming was, we can always find shortcomings in hindsight. We can say we wish we did things earlier and later. I think one thing I really noticed is that it took a little while to take things seriously. It wasn't the fault of New York. We just were the beginning of realizing what to do with this virus. And so, in the very beginning of March when I was there, people were still going to restaurants and they were still hanging out at bars and still joining in with each other outside without wearing any face covers or masks. And of course, there was no mandate to wear one. And so people really didn't know, and the grocery stores were packed, and it was, it was hustling and bustling, beautiful New York City. So, and over time, it sort of quieted down, and people really did start taking it seriously, and it made such a big difference as far as flattening the curve. So I think, you know, I started to feel like I was in a bubble there, and I thought the entire country was being really, really diligent about wearing face covers when they went out, limiting going out, not going to the grocery stores unless they had to, ordering everything. And I got home to Maryland, and I have to tell you, Susan, it's not what I noticed here. So it was really heartbreaking because as soon as I got off the highway and I was in the suburbs, and I just saw person after person out there walking their dogs, riding their bikes, exercising, and they were not wearing face covers, and they were walking, with a couple of people around them. So
Yeah, that outside aspect of wearing a mask has been difficult for people to grasp. So you're saying that you really think it's important, even when you're outside, to have that mask on.
I sure do. And I think that it's a really important point to emphasize, because even, friends and family and loved ones who sort of hear me saying it over and over, they still sort of feel like, oh, but it's outside. There's so much fresh open air. How can it be a concern out here? Well, the problem is that most of the data that we have, it is from labs that were done inside. And so, for example, that 6 foot distance that we sort of have on repeat for you guys is from testing that was done inside of a lab. But the thing is, when you go outside, you have other factors you have to consider. That wind can carry those droplets from the virus further. And so it's actually more important to have a face cover on when we can't predict how many feet you have to be apart. And then, of course, when you're exercising and you're on your bike or you're going for your jog, you're breathing a little heavier, you might be spinning a little bit when you're running, and imagine crossing by a sweet grandmother on the other side, and you just, infect someone as you pass. And I know no one wants to do it intentionally, and they have the best of intentions, and they just want to get outside, and I completely understand the desire to exercise, and I encourage it, but I do encourage it with a face cover on.
Yeah, and that's really important as states are starting to loosen the restrictions on the stay-at-home order. Governor Hogan yesterday lifted it here in Maryland, although it's going on a county-by-county basis. Folks can decide, the governments, the local municipalities can decide on their own whether or not they're going to go ahead with that phase one. But what do you see is the key to getting ahead of this pandemic? Testing seems to have been a big issue. Does everybody need to be tested for this?
That's such a great question. I think testing is a really complicated point with this virus. Testing, if it was perfect, would be a great mechanism to getting people back to work. We could say we will, in blocks, test everyone in every county and make sure that they're super safe and get them back to school and work.
Mm-hmm.
The problem is, again, because this virus is really new, in the grand scheme of how long it takes to come up with really perfect tests, treatments, and vaccines. And so the tests aren't perfect. There's something called a false positive and a false negative rate, and sensitivity and specificity. And without getting too muddled in it, it pretty much means that a test can say you're positive and you're really negative, or it can say you're negative and you're positive. So that means if we're going to use a test to getting people back to work, we're still risking a fraction of those people having the wrong results, really. Mm-hmm. So, it's important to test people. The test is as good as it can be for where we are in the science of this virus. And for the most part, we are proceeding with whatever tests say. But it's important to not feel a false sense of security when a test is positive or negative. You still want to be really careful about your loved ones. You still want to do the social distancing, the face covers, and the hand washing and everything else, because the other thing we don't know is if once you get the virus, we don't know if you're going to stay immune. So we really just have to be really careful.
And that goes to my next question for people who are asymptomatic. There are people around us who are carrying this virus. We don't know who they are, which takes us back to your point about the social distancing and the wearing the masks. Is you just have to assume that, you could be a carrier.
That's right. And more we're finding that it ranges between 30 to 50% of people who have this virus are asymptomatic. And I think we really forget the fact that being asymptomatic doesn't make you, safer to be around. You're truly shedding that virus and passing that virus just like someone who is coughing and sneezing and showing real signs of being sick. You're just as likely to pass it on. And so, I know when I feel really good and healthy, I might not be as aware to wash my hands every single time I touch my face or every single time I do something. Of course, we're a little bit more careful when we're sick, but you're just as likely to spread it. So I know there's fatigue. I know we've all been through this for a really long time at this point, but we really can't let our guards down. We really have to be as careful as we can as far as preventing disease spread.
And what about the governor's decision yesterday? I know some folks are probably going to be rushing to the store this weekend since the weather is nice. How do you feel about those decisions and how he's come to those realizations on how we need to reopen Maryland?
Yeah, I think it's tricky. I don't pretend to be in any of their shoes, and I know that they're taking all the evidence they can and making decisions based on the sort of protocol they have in place, that you have to know that you can test enough people and that you have the resources available if there is a surge in the number of cases. And so the decisions are being made using certain guidelines, which I think are great. I think the work we have to do as citizens in Maryland and in every other state is that just because stay-at-home orders are lowered or we're encouraged to go back to work, it doesn't mean that we're encouraged to do it incorrectly. Um, you know, these decisions are really being made for the benefit of our economy, and you have to weigh that against what it could do to health and to the number of cases we're going to expect to see that will likely shoot up. So if we can agree that it's for the economy and we're going to go back to certain kind of stores and workplaces opening again, let's not let that go into a slippery slope of us just gathering in parks and on beaches and in places of leisure, because these decisions really are made for the benefit of the economy and not for our boredom. And I know the fatigue is real, but we have to take it step by step because there will be a surge in cases. It's very likely. Other states that have opened, like Florida, for example, where people have gone to the beaches, we've seen a really dramatic surge in the number of cases.
Yeah, yeah. So just exercise that caution as we have been for the past several weeks. Do you believe that it's critical that a vaccine is developed to really get this under control? Is that what we need to have? Or, the treatments that are out there right now, like remdesivir and those types of treatments are lessening the symptoms and helping people get better quickly. What do you see as the best solution moving forward to really get a handle on this?
Such a great question. There's, I think, something over 160 treatments and vaccines that are currently being worked on. And with the vaccines alone, there was almost, I don't know, over 100 different labs trying to get a vaccine out. And, only a handful of them, of course, made it to what's called a phase trial, where we're working in humans and going to see if this is a viable option. The very, very best case scenario for a vaccine is 12 to 18 months. I know we've heard that number kind of going out and about. And the reason for that is that at each phase in a vaccine trial, you have to test a certain number of people. You have to let it sort of sit in them for a while. It's not the sort of thing that you want to rush. And the reason for that is if we get to the end of it and a vaccine makes it and it's just not as effective as we wanted it to be, you're still putting a vaccine in people in hopes of protection. And so you want to get a good viable vaccine out and you want to get good treatments out. Right now, we don't have a true treatment for COVID-19. Remdesivir is the closest we have to something that shortens the length of stay you have in a hospital. And so, for example, even with remdesivir, we see that people were able to shave 4 days off their hospital stay. Now, that is really significant considering that every single one of those days, folks are on ventilators and need breathing treatments and other interventions. But it's still in a trial, and it's sort of the best we have.
Mhm.
But I'm really, really encouraged. There's pretty much every scientist on the planet working on the same thing at the same time, and we really don't see that very often in medicine. And so I'm really encouraged with all the most motivated and brightest minds we have are working on this at the same time. So ideally, for a true reopening of the entire country, I do think we need either a treatment or a vaccine. But I think in the meantime, as we kind of open things in stages, we just have to be prepared um, for variations in our surge numbers. And if that means that a couple of months down the line, we realize the numbers are just getting too high again, and we need to go back to staying at home, well, we sort of have to be mentally prepared to do that.
Well, Dr. Taghipour, it was wonderful to meet you, and thank you so much for your time. I just really had it's been an interesting conversation, lots of great information. You stay safe and you stay healthy.
Oh, thank you so much. It was lovely chatting with you, and I really hope that all of your viewers are staying safe and healthy, and I hope the same for you. Thank you so much, Susan.
Thank you. Okay, let me end that record. It was great.